Wanted to ask about the number of daily tests being completed in Ontario. On Sunday, the province hit a record high with 17,000 tests, but today we're down to 10,000 once again. There is capacity in the system to do more testing now, so why isn't the province using its full testing capacity? And how can we even think about reopening when we don't have a clear picture of how this virus is spreading in our communities?
So I was on good question. I was on here last few days saying they're doing a great job. They were hitting 17,000 consistently, and then all of a sudden you come in and you see the 10,000. I still say everyone's doing a great job, but when I looked at the chart, I'm going to get back on the table this afternoon. But when I look at the chart, it starts up here and it goes all the way down, and there's certain medical officers in certain jurisdictions. Now, keep in mind, we have 34 chief medical officers across the province. Some just aren't performing. I'm calling them out right now. You got to pick up the pace when you have a whole bunch of them, half of them really exceeding expectations, and then you have some others that just aren't even putting the work in as far as I can see. So we need to hold these people accountable, and that goes back to my conversation about after this is over, we need to review it and start looking at the Alberta model. It's a lot easier to have one person in control than 34 people in control. And I'll tell you right now, I'm disappointed on the chief medical officers in certain regions. I'm not going to name them. They know who they are. Start picking up your socks and start doing testing. I don't know what the big problem is with them testing. It's frustrating as anything. So sorry, but it gets frustrating. They need to pick it up, and as simple as that. And we'll be speaking to them over the next day or two and find out the reason they just are not testing to the capacity that they should be testing.
Follow up? Okay, and just to follow up on that, we are still hearing stories of people being turned away from testing. There are still limitations on who qualifies for a test. So I'm just wondering when some of these rules might be modified to accommodate more of the public.
Well, we've been seeing the testing ramp up on all long-term care, and we need every single long-term care patient and frontline healthcare worker tested. I just don't know how much more complicated that can be. Go out there and start testing. And start working on retirement homes and the workers there, and start working on the healthcare workers. And then we have to also test the public. These people are smart people. Just continue testing. It's frustrating to say the least. And don't get me wrong, there's other chief medical officers that are knocking it out of the park, but half of them aren't. So we're going to have to get on the phone with them and find out what reason, what excuse they're going to give us why they aren't testing.